morning. Uh, I am Dr. Paliwal from Fortis Intensive Care, and I would like to say only one thing on the World Hand Hygiene Day is that it is the single most important step in preventing our patients from infections, and it is the only thing which will save our patient and us from the menace of multi-drug resistant infections. Thank you.
I'm Dr. K. M. Mandana, Director Cardiac Surgery at Fortis Hospital in Anandapur, Kolkata. And today, which is May 5th, is the World Hand Hygiene Day. So I'm going to give you a special message right across to all the fraternity who work in this hospital, with the nurses, the doctors, junior doctors, consultants, and the other ancillary staff who works in the ICU. Everybody is very, very important as a key member in preventing the hospital-acquired infections and preventing what we call as the multi-drug resistant bugs. As you know that no new antibiotics are coming, and we should stress upon, therefore, on strict practices for hand hygiene, which is actually pretty good in the nurses and the ancillary staff, but as far as the doctors and junior doctors go, we have a worst reputation of not abiding by the hand hygiene techniques. So this is reiterating again that please follow that. It's very important in the ICU settings where patients stay for a longer duration and are immunocompromised. Thereby we follow the practices and teach each other, keep the awareness going between our faculty as well and the staff as well as the nurses as well, as we keep on getting newer staff members, that what importance it carries to practice a good hand hygiene and thereby preventing the hospital-acquired infection. As we all know that initially also the stethoscopes and the white lab coats which we used to wear were the bugbears for the infection and transmitting between patients to patients. Today we know that that has been taken care of, but still post-COVID, what is important is special care of your hands before going and touching any patient in the ICU or in the hospital. So take care of that. Have a good day and keep scrubbing yourself. Take care. Bye-bye.
Hygiene Day, if there is one thing I would say where you can be a responsible healthcare worker, doctor, nurse or anyone else who is looking after the patient, a physiotherapist, it is hand hygiene that avoids hospital-acquired infections. Before going to the patient, always clean your hands properly, as has been said, and then after you've seen the patient, always sanitize your hands. Sanitizing is not washing. Patients who have MRSA, who have C. diff, you definitely need to wash your hands. So go to the nearest tap, wash your hands properly in all the steps that have been said. This way, you will not only help your patients, but also not take back infection home. So hand hygiene, be a hand hygiene champion.
Dear friends, good morning to all of you. On this occasion of World Hand Hygiene Day, I wish all of you to keep in mind the safety of patient. We know that as per the International Patient Safety Goal 5, we have to save the patients from healthcare associated infection. And if we remember the quote of Florence Nightingale, do no harm to our patient. So keeping these two in mind, we have to know whenever a patient is admitted to healthcare industry, the most important thing, we should not introduce any infection to our patient, and that can be only prevented when we maintain hand hygiene practices efficiently. As a nurse, when we are in the organization or any other healthcare professional, doctors, housekeeping, technicians, whoever are coming in contact with the patient, the primary important things that is hand hygiene. We have to wash our hand before touching the patient, and and after touching the patient, as well as we have to remember all the moments of hand hygiene and the steps of hand hygiene. By this way, we will keep our patient free of infection. When a nurse working in a critical care area, she needs to be alert, and because patients are with various lines, tubules, and every moment it is the responsibility of the nurse and a doctor to keep those lines and the tubings, all the ports free of infection. And that is only possible when we follow hand hygiene principles. So hand hygiene should be not only in our memory or in our brain, but it should become a muscle memory. So using soap water to clean our hand and using hand rub, which is kept at the bedside of the patient every moment whenever we are at the side of patients or want to check or want to do any procedures. So on this day, I wish you all to practice hand hygiene efficiently every moment, every day, every seconds, so that our patient will be free of infection. Thank you very much.
Hello, I am Dr. Shubhajit Sen, and on the occasion of World Hand Hygiene Day on 5th of May 2025, I would like to say that hand hygiene is the most effective and the most efficient way of preventing hospital-acquired infection. So I will request everyone attached with healthcare and attached with patient care management to do and keep yourself germ-free and help us to fight antibiotic resistance.